as a public health official, you have to recognize the kids not going to school is a public health problem. The young adults being depressed is a public health problem. The people being out of work and not being able to feed their families is a public health problem. And so you have to be able to work your way through and talk about it and help elected officials, the ultimate decision makers, see both sides and see as best as you can what those trade-offs are and try to find a path between it. It's messy.
Dr. Joshua Sharfstein, thank you for joining me on the AUXORO Podcast.
Thanks for having me, Zach.
Of course. So I thought we would start with an impossible question to jump right into things, to start things off smoothly. So you wrote the book, The Public Health Crisis Survival Guide, Leadership and Management in Trying Times, which was published in June of 2018. And then less than 2 years later, the world was hit by the global pandemic of COVID-19. So looking back on the past 2 years, having the hindsight that you do now, how would you grade the overall response of public health officials to the COVID-19 pandemic?
Well, first of all, thanks for having me on the podcast. And that is quite a question to jump into right off the bat. You know, when I wrote that book, I wrote it because I thought people were not paying enough attention to crises, believe it or not, in public health, and that they were very focused on strategic planning, or particularly the teaching of public health was very focused on the underlying principles, the use of data. All those are good things. But I knew from my own experience that when you're in public health, it's the crises that really are the make or break moments. They're really the critical things. It's when people really pay attention to public health. So I wrote that report, that book, and actually teach a class on crises at the School of Public Health at Johns Hopkins, all about the idea of being ready for that moment because it's so important to do well. So you can bet as this new, virus started circulating that I was wondering, what was going to happen, paying a lot of attention to it. We actually had a class happening right then. So every week we would talk about what was going on. One of the key themes of the class is that people tend to minimize the threat of a crisis. Everybody is so focused on the normal that you don't pay attention to something that is really dangerous. And of course, that absolutely happened. It happened in China. It happened in the United States. It happened to many countries, downplayed the threat initially, and wound up, pretty far behind in the response. And so it's been a really, terrible, terrible pandemic. It's been terrible just in general for so many people having died in this country. It's been terrible for the world and in the struggles to, get critical supplies out, vaccines. And it has not been good for public health. I think, public health was a little bit storm-tossed, like a little ship on the waters of politics and polarization. And, I think very early on when President Trump pretty much decided that the public health people would be the people who say no, and he was going to be the person that says yes, and sort of set up that dichotomy, it really created a dynamic, or at least accelerated a dynamic that has been very, very difficult for public health. And we've seen hundreds of people pushed out of their jobs, fired, retired under pressure, a lot of harassment of public health officials. So I don't think anybody would say this has been a shining moment for public health. The real critical question is going to be, how do we dig out from this? What lessons can we learn? How do we strengthen the system moving forward? And I'll just say, in my book, in my class, that is a absolutely critical question. If you just think about the crisis as a momentary passing thing, now we can get back to our strategic plan. You lose the opportunity to fix some issues, and we really need to do that.
Yeah, it's a weird time because you will have people that say we don't prepare enough for crisis, which it definitely seems like is true. We don't put enough effort in society to prepare for a crisis like COVID-19. And then when organizations do try to run crisis preparation or these simulations of what a crisis would be like, then people point to that as a conspiracy of, oh, look, this was being planned ahead of time because people were trying to prepare for a situation. And that whole what's real, what's not dynamic, I'm sure can make things very difficult from a public policy standpoint.
It sure does. And, I can't say that even though I have worked on issues of misinformation in the past, just the scale and the sheer volume of misinformation, disinformation has been surprising to me. And, I think everyone in public health has been caught a little flat-footed. I recently went on C-SPAN, Washington Journal, and one of the questions I got was, how is it possible that Johns Hopkins did a simulation of a pandemic exactly 666 days before the World Health Organization declared COVID to be a pandemic? Is that just coincidence? I mean, that was the question that I got.
300, what they were saying, there's something demonic about the number 366 or 666.
666. Yeah.
666.
Yeah, exactly. Yeah. They were saying, how is that possible that happened? I said, well, Johns Hopkins does a lot of simulations of pandemics because we're worried about pandemics like all the time. It's not just, any given number of days. Pretty much almost any number of days, you probably find Johns Hopkins doing some simulation of a pandemic. It's because there's such a thing as pandemics and we're worried about them and we want to be prepared. But it has been incredible, the level of conspiracy theories that have happened.
What are some of the biggest conspiracy theories or campaigns of misinformation that have given you the most trouble as someone who's trying to orchestrate public health strategy and trying to make society healthier as a whole? What are some of the biggest hurdles in that sort of conspiracy sphere that have really allow people to dig their feet in the ground?
Well, I think the misinformation about the vaccines has been just incredibly harmful. I mean, here we have a brand new virus. Human beings never really have seen it before. It can cause profoundly serious disease, and it's obviously killing people all over the place. And you have a vaccine that does extremely well in very large clinical studies, has a very strong safety record. The evidence is just enormous that it protects against serious illness and death. And you have a lot of people spreading misinformation, believing, unfortunately, misinformation that the vaccine is more harmful than the disease, or that, it's hasn't been studied, or it's a big experiment. And then you even go further down the rabbit hole. It has microchips in it or whatever else is there. And to me, it's not the weirdness of the idea, it's the impact that's really disheartening. So, people, there was a series, the New York Times actually did like one of those video op-eds kind of, where they went into a hospital and they interviewed people in the intensive care unit who did not get vaccinated, and they asked them why. And they were trying to explain in between struggling for breath. And some of them were like, I really should have, gotten vaccinated. I don't know why I was listening to all this nonsense. But some of them were like, I still have questions about whether it's a good idea to be vaccinated, and some of those people died right afterwards. And so it is incredible, how people were misled. And it's just tragic. I mean, I don't feel any sense of like, told you so when you see like a radio host or somebody who's died not being vaccinated. You just feel this just terrible pain, not only for them and their families, but for all the people who listened.
Yeah. At that point, it's a little late to be asking questions and figuring things out when you're actually in the ICU. But when I was deciding whether or not to get the vaccine and going through information, this is about March or April of 2021. And I was aware of the conspiracy theories. That wasn't very much a concern of mine, but I was going through information, asking questions to some of my friends. And I should say I'm in Brooklyn, New York, so overall very liberal area. And I found that just asking questions about the vaccine and wanting to get information was getting me thrown into a conspiracy sort of anti-vax group a little bit, when in reality, I just wanted to listen to a bunch of podcasts and read some studies before I put something into my body, which is what I would do for anything else. So it's outrageous, some of the conspiracy theories that I've come across, but also at the same time, and I'm sure you would agree with this, it is important to be open to questions that people have and being open and not necessarily like throwing them in that bucket immediately.
I totally agree with that. And I did so many different like Zooms and meetings and phone calls, really any question. Send me any question. Let's talk it over. Let me understand. I think it's really important. There were a bunch of times when, I was emphasizing that to my peers, like, our position has got to be ask questions and be honest about what's known and what's not known.
Yeah.
My, different people would call me for different reasons. I don't know how to put it, like, please talk to my neighbor, please talk to my brother. They're not getting vaccinated. And I would always do those. I would be like, sure, I'll talk, I don't know with them. And I get on the phone with them. And, one of the things they almost invariably said was, I thought you were going to yell at me for having these questions. And I'm like, yeah, I'm not going to yell at you. I want to know what the questions are, But I would just, like, somebody who said, like, I don't see why I could get sick because I'm just in my house all the time. So why should I bother getting vaccinated? And I was like, are your kids in your house all the time? It's like, no, the kids are going to school. I was like, well, what do you think the chance the kids are going to get exposed at school is? I'm just like, what do you think that is? Because I think it's pretty close to 100%. They're going to bring it home. So are they living in a different part of the house? I mean, you are going to get exposed. I'm not saying you can make whatever decision you want about the virus, but, like, don't say no on the grounds that you're safe because you're at home if your kids are going to school every day.
Hey guys, this is a quick reminder that the two best ways you can support the show are by 1, leaving a rating and comment on Apple Podcasts and Spotify. This is like foreplay for the algorithm because it revs it up and makes our show appear higher in searches. And number 2, you can subscribe to AUXORO Premium at auxoro.supercast.com, where for $5 a month you get bonus episodes and more exclusive content. Thank you for however you choose to support the show. Yeah. Are there any conversations in particular about the vaccine that you remember early on where someone was hesitant about it and then you provided some information that ended up changing their minds?
Sure. Well, there are a number of them. I mean, I think I can't say I convinced everybody to get the vaccine, but I definitely have talked to people and helped. One was actually a podcast host here in Baltimore who was just convinced that he didn't need it. And we were on the podcast and I said to him, what does your family think? One of the things I learned, because I volunteer with the health department in Baltimore City and I was going out to vaccinate a lot. I still do that from time to time. And, as the year went on, I mean, initially, all the people who were there are so excited to get vaccinated. I mean, every time I went, it was like a party. Then you go and, you're getting people who have obviously waited, And I would, talk to them and ask them, what was it? What was it? What was the thing? And, sometimes people would say it's the Delta variant or something. But much more frequently, they wouldn't answer with a reason. They would answer with a name of someone. Like I would say, so what made you get vaccinated? It wasn't like, I finally read that article on the, immunogenicity of the Pfizer vaccine. That's not what they said. They said, my mother, I'm worried about my mother and I realize I need to get vaccinated for her so I don't get her sick. Or my girlfriend said I had to do it. Something like that. Then eventually there were some people who had to get vaccinated for work. But the people who did it clearly of their own volition, it was for who? It wasn't for why. And so when I was on the phone with this podcast host, I was like, who in your life wants you to be vaccinated? And he said, my kids are really on me to get vaccinated. And I said, why do you think? And, we talked about it. And I think the next weekend I met him at the pharmacy. He got vaccinated.
Wow. Yeah, I was also convinced by a podcast. I came across your podcast much later on. And when I was deciding whether or not to get vaccinated, I came across a couple podcasts by Dr. Peter Attia, who's down in Austin, Texas now. And he spoke about the benefits of getting the vaccine and the recommendations that he was giving to his patients. And then he was also helping to administer the vaccine out in the community like yourself. And so for me, that really changed my mind of, okay, this guy's not only recommending the vaccine, he's a highly reputable doctor. He's in the space and he's helping administer it to other people. Like if figures of public figures that are in the medical space and experts on this type of stuff are both promoting the benefits of the vaccine and giving it to other people, then for me, that was kind of the nail in the coffin of, okay, like I'm going to get vaccinated.
I agree with you, except I might say the nail out of the coffin.
Nail out of the coffin. There we go. Mm-hmm. Yeah. Yeah. So let's go back to March 2020. What were you noticing about the way that the COVID data was being transformed into actionable guidelines to the public during that time? Because there were a lot of pushbacks and pullbacks and directives and then walking things back like very early on. Do you remember having a certain sort of feeling or any things that stand out from the March 2020 guidelines leading up to the shutdown?
You know, so little was really understood about the virus at that time. And we can look back now and just see how misunderstood the virus was. You know, a lot of what we understood about coronaviruses was from SARS. This didn't behave like SARS. It's a different coronavirus, or MERS, another coronavirus, or common cold viruses. This wasn't like any of the coronaviruses that existed before. And so, you know, I think there's a market for people who sound really confident about what they're saying, right? I mean, we have just a huge, need to fill content on every platform, every place you look. And people who are really confident, they got a huge microphone, to talk about what was going on. And that included people saying, well, there's going to be between 140,000 and 160,000 deaths in the United States, or whatever it was, like so early on, based on so little information we can now see in retrospect. We didn't know how the virus transmitted. We didn't know that the virus would mutate like this. So you look back and just realize what kind of blinders we had on at that time. And it's really hard to say, we really don't know what's going on here. We're going to be taking some precautionary steps as best we can and filling in the details. That's not a message that got you on a lot of, TV shows, really. The TV shows were like, these are the cities that are going to be hit the hardest. And this is and there was just a lot of information being put out. I mean, it's embarrassing to go back and look at what was there, but there was a market for it. People really want to hear that. And in some ways it helps people get through to hear people's best guess of what's going to happen. I think we probably would have made it through that process, except for the fact that it got politicized, because I think the evolving science plus politics equation is a recipe for disaster. Like, evolving science is a recipe for a little bit of confusion, but if you trust the people talking to you, they can explain. We thought this before, here's what we've learned, we think something different now. You throw politics in the mix, and suddenly it's like evolving science means that changing your mind on something looks like a flip-flop, that it looks like you're incompetent, and you're trying to take away, someone's rights to not wear a mask or whatever it is. And it becomes just much, much harder to kind of sort through the actual evidence. And, it's just really hard. When I worked during 9/11, I worked on Capitol Hill. I worked for a great congressman named Henry Waxman. And I was there for the anthrax attacks. That might have been a little bit before your time. I don't know if you remember the anthrax attacks.
I was born in 93, so I remember it a little bit.
You were about 8. Yeah.
Yeah.
So these were these letters that were sent, and people were dying because the anthrax was getting out in the mail and people didn't know what was going on. And after the first person died, I went to a press conference at the Department of Health and Human Services, and they pushed out an official who was not a doctor. And I remember Anthony Fauci at the time was standing behind him, but not at the mic. And this person looked out and said, there's absolutely no reason to worry. The person who got sick was a spelunker, and we think he got it in a cave. And you could just almost see like a caption coming out of Anthony Fauci's head, like, I wouldn't have said that. We don't know here. But the just desire to fill the void was so strong. But then when it turned out like this was not from spelunking, this was basically a terrorist attack, then, you never saw that person again because their credibility was totally gone. So, the teaching in public health communication is really to be clear about what you know and what you don't know, and maintain credibility by being honest. But it was just so hard the way the politics played, because people who really did that were really undermined. So it created just a mess at the beginning of the pandemic.
Yeah, there's so much pressure nowadays to have a hard take on every single issue. And I succumb to that sometimes as a podcaster. I've done a few solo podcasts, and you see things in the news like the Will Smith slap or some new revelation about, it could be something COVID related or vaccine. Then you're branching into pop culture, movies, and all these things get mashed together. And you have people that a lot of times I'll always go out of my way to say, this is just me reacting to something. I'm not an expert in any way. Just in case that wasn't clear by the way that I'm dressing, I have a man bun with a t-shirt on. One of my favorite music artists. Like, to be clear, I'm not an expert on this, but there are a lot of people who don't make that distinction, and they speak with confidence. And a lot of times we're just drawn to the people who don't necessarily have the right take, but they sound like they're the most invested in it. And I think about this a lot, just being a podcaster, is how much of building an audience is doing your due diligence and researching for interviews, and how much of your audience is built by having just hard, entertaining takes, whether or not it's right or wrong, just to keep people listening. And I don't think you have to do one or the other. I think sometimes the silly topics like the Will Smith slap, you can just go run with something. It's you're talking about two millionaires slapping each other, like nothing really bad is gonna happen. But with things like COVID, it starts to get a little dicey, and people get misled, and it's such a clickable, clickbaity topic.
Well, I think, first of all, shouldn't judge anyone by their appearance, including yourself. That would be, one thing to go by. But second of all, I totally accept your point. There is a lot of pressure to be definitive, and it's really hard. And you throw politics on top of that too. It really makes it super challenging. And a lot of public health officials, have been hit by that one way or the other. And I just think there was a moment in April of 2020 when President Trump wasn't doing a bad job. I mean, he was basically talking to the public about how serious the problem was. And maybe late March, probably is what I'm thinking. And he was saying that, look, we're going to, work on this together. And that moment faded pretty quick. And before you know it, he was tweeting, liberate Michigan or whatever. But during that moment, I think he was actually pulling the country together. And, that's the public part of public health. Public health is about, the definition is what we as a society do together to assure the conditions in which people can be healthy. It's a lot of, we together, those kinds of words. And you have to come together. There was an interesting study by a friend of mine, Tom Boleke, and colleagues that found that one of the most important predictors of whether a country did well in COVID was the level of trust that people had for the government. And so, what we do together, what we do through government, whether there's trust, those things really matter for a pandemic response. And when people were deliberately trying to sow the seeds of distrust or benefit from that politically, that was really miserable for our response.
Yeah, President Trump had the superpower of meme culture, and he definitely could have directed that superpower much more towards the benefit of the public health of the people. He's entertaining for sure. And I remember there was this one segment where people were asking him what we should do about all these hurricanes and climate change and stuff like that. And he was like, I don't know, maybe we should just nuke the hurricanes. And it made me laugh. And I was like, oh, this is wild. We just had a president that was saying we should nuke the hurricanes. he could have brought some of that meme energy to COVID and still make some of these wild statements on Twitter. And at the end, he could have pulled it back, be like, I don't know, like you should probably get vaccinated. Like that's what the data said. But he left it at the divisive element instead of directing those clicks towards the betterment of the people. Maybe that was a pipe dream. Maybe someone like Trump isn't capable of being that divisive, but also using his powers for good. Maybe that's something just innate to a character like that. But it was wild to watch nonetheless. It was people on both sides about like a medical treatment. The first time in my life that a medical treatment, the vaccine became politicized, where if you got the vaccine, people were like, oh, I know who you voted for. And then if you didn't get the vaccine, people were like, oh, I know who you voted for. And then it's just like this, like no other medical procedure has ever had that effect on people.
It's really not good. And, Trump was vaccinated, but he obviously could have done a lot more for people who are listening to him quite a lot.
Yeah, absolutely. What was the chatter like on your home turf of Johns Hopkins back in February, March of 2020? Because like we were talking about, a lot of people have takes. A lot of people are getting on podcasts saying wild shit about COVID. What was the internal chatter like at Johns Hopkins leading up to the shutdown?
Well, there was a lot, and that's what led us to start this podcast, our podcast, Public Health on Call, because the hallway conversations were pretty interesting. And so we were like, we have some different kinds of experts at the school. We have virologists, we have emergency preparedness experts, we have modelers. So we put them on, the podcast. We have infection control doctors. And, I actually think those early podcasts stand the test of time pretty well. Like, somebody very early, I think probably was our first podcast, was Justin Lessler. And he said he's an expert infectious disease modeler. So he does infectious disease epidemiology. And he said, let me tell you, the most important thing is whether there's asymptomatic spread. If there's asymptomatic spread, this is going everywhere. That's on our first podcast, I think. And sure enough, there's
and what is that? That's
spread.
Like back in, is that February, March? Or do you remember
that's
what?
The very beginning of March. Very, very beginning of March. People did not know what was going on, And we also talked to, a little later, Lisa Maragakis and Gabe Kellen from the medical school. Lisa's an infectious disease doctor. Gabe is an emergency room physician. Really experienced people who've worked on Ebola and all kinds of things. And, I felt just butterflies in my stomach about what was happening. That sort of uneasiness about like, what in the world are we dealing with? Just so many crazy things that already happened, even in the first couple of weeks of March. And they said, we're going to be ready. We are preparing ourselves for an incredibly serious event and, a surge capacity well beyond anything we've seen before. And we have got to be ready. And they kind of come across in those early podcasts as like, calm and prepared, which was not my mentality, just reading everything. And, that wound up to be true. I think that that wasn't calm and prepared because everything was going to be all right. It was calm and prepared, like, because we're going to get through this. And, when you wear, protective equipment, you're not going to get sick. And we've got enough protective equipment, at least here, and we're going to be able to use it. So I kind of felt this mix of, I think we had a much better sense of the scale of what we were dealing with, probably at Johns Hopkins than a lot of places. But at the same time, we had a sense of the different things that could be done. It just was really clear that so much had to be done together, that the public part of public health was going to be a major theme. And, I'm very interested in kind of the politics of public health. And so as I saw that going south, I really, over the course of the spring, had a very, very, very bad feeling about the whole thing.
Yeah. I imagine with all of the experts like yourself and other virologists and infectious disease experts at Johns Hopkins, you were plugged. It was a unique position because you're plugged into the cream of the crop conversation and data, and I'm sure people are sending out things in group text like, oh, take a look at this study, or this says this. We just learned this from China. And then you're seeing the public discourse on Twitter and public health officials saying stuff and politicians saying stuff. And I imagine that was kind of a whirlwind of a time to wrap your head around as a public health strategist, public health official.
Yeah, it was pretty exhausting too. And then everything else, that's going on. My wife is an addiction medicine physician, and she had to shut down a clinic that was giving treatments to, 500 patients a day. And figure out how to keep getting them the treatments. I mean, shut down, not in the sense of closing, but like shut down the physical space. And that, it was just crazy, what she was working on. Her life was turned upside down. And then we had 2 kids at home, their lives were turned upside down. So it was just the full experience.
Yeah. Yeah. I remember one of the huge topics and ended up being a lot of tragedies in New York was the decision whether or not to close the elderly home care places, and people catching COVID and then being sent back to the home care facilities and then being taken out again. And there was kind of this whole back and forth that led to a lot of old people losing their lives. And I'm not smart enough to know what to do in that situation, but I remember just hearing about those types of situations and feeling very lucky to be younger and not in an at-risk category, but at the same time, you don't want to be in a position where you're just sacrificing the lives of old people.
You do not want to be in that position, but and there are actually, some pandemics that actually are more likely to kill people who are in the 20 to 30 age range. So to a certain extent, COVID, was different than other pandemics. The 1918 pandemic, for example, was more likely to kill younger people, or very likely to kill younger people at least. I think that issue that you raise is complicated, because I think that probably the best evidence is people went to work in these communities when they were infected but asymptomatic, and they spread the virus to people that they were working with. I don't think that the most cases happen because people were being discharged from hospitals weeks later and going to, I think the level of infectiousness is much less at that point compared to someone who's a day or two away from symptoms. And so what you saw is that the nursing homes had the most cases when their communities had the most cases. It became a huge political issue in New York because the governor wasn't particularly forthcoming about certain policies and certain data that he had. But as like a public health matter, I haven't seen compelling data to say that policy of sending people back to nursing homes was really that important. The big challenge is just the lack of protective equipment in nursing homes, and the fact that people were going in there the lack of testing, not knowing whether or not they were infected, and giving people COVID. And then you had just such susceptible people.
Yeah, I wanted to get into some of that contradiction between the seeming contradiction between policy and the information that was available to experts at the time. And I was lucky enough to be able to record podcasts with people throughout the pandemic. I don't think I took a week off because I went from in-person podcast to recording remote, and now it's kind of a hybrid. So I was lucky to get a lot of people's opinions on how information was being shared to the public, how they felt about things. Not all of them are experts. Most people were in other industries, but they were reacting to some of the information. And to prepare for this podcast, I was looking at a timeline of the coronavirus pandemic response. You can find this on justsecurity.org for anyone that's listening. It kind of it does give quotes and studies that were released from March 2020 all the way through, or February 2020, excuse me, all the way through today. And I will give I'll give a long-winded, like couple minutes breakdown of some of the messaging that I was coming across on this timeline, and I wanted to ask you some questions about it as someone who's in the public health strategy space.
Sure.
So I was breaking this down into two different segments when I was bulleting this information. So I had non-mainstream messaging versus the mainstream messaging. And so the non-mainstream messaging, I group that as kind of internal chatter between doctors, researchers, some NIH officials, things that weren't being broadcast on, like CNN, Fox News, like major platforms at the time. So non-mainstream messaging, this is from January to February 2020. There was a paper in the New England Journal of Medicine that confirmed asymptomatic transmission. The WHO declared COVID-19 a public health emergency. Rick Bright, the director of HHS biomedical research team, warns of a quote unquote critical need for surgical masks. And there was a Red Dawn email chain of pandemic experts and public officials that reads, "We need to pull all the triggers now. We are flying blind and people are carrying the virus everywhere." And that's January to February 2020. And at the same time, the mainstream messaging, and I mean this as just any messaging that was public facing, and the two people that were speaking out the most about the pandemic in these platforms were Trump and Fauci. And so between January and February 2020, Trump said that the virus is, quote, very much under control. Fauci sort of echoed Trump, where he said it was low risk and Americans do not need to change their day-to-day practices. And there's no reason to be walking around with a mask. And a lot of people that I've had conversations with will point to the contradiction in the data that was available at the time, now that we have hindsight looking back on it, and the public messaging from these figures and positions to reach millions, hundreds of millions of people. And I wanted to ask you, as someone at the forefront of public health strategy, can you help me understand the motivation behind this seeming contradiction, or any disagreements or agreements that pop into your head about this contradiction between the data that was available and what the message was to the people?
Sure. Well, I think during that period, people who were, are aware about pandemics and the potential of a coronavirus in particular to cause a pandemic were getting increasingly worried. And that's definitely, what we were hearing at the School of Public Health. But at the same time, if you talk to them at the time, they wouldn't say, we know exactly what's going to happen. They would say, this is worrisome. Here are the things that look worrisome. It was not very well established asymptomatic transmission during that period. I told you I was doing that interview at the very beginning of March with one of the top infectious disease epidemiologists. And he said, we don't know this yet. It has not been established. But he was very concerned and said, look, this is the most important thing to know. So there was a very high level of concern, although I don't think it's quite that we knew everything that we knew now, certainly. But even that like everybody knew exactly what to do. And there's always a little bit of fear that you're going to be Chicken Little, But in general, I think people were increasingly concerned over that period. And of course, you got to the end of February and they let the CDC do one press conference, and Nancy Messonnier said something to the effect of, our entire lives are about to change, and then Trump, was furious with her. But I think she reflected sort of the prevailing wisdom within public health that there was a big challenge.
He was furious with her for saying that our lives were about to change. Was
yes.
it for because he thought she was inciting panic or something, even
correct.
if it was true?
Correct. And the stock market had gone down, and so he didn't want that, and he was doubling down on reassuring. Yeah. I think I don't put Trump and Fauci in the same category. For President Trump, I think the most charitable explanation is that he really didn't see the point of scaring people. Or he just felt that he was really hoping that it wouldn't be a problem. And if he said it, maybe that would make it true. But what he was saying was not supported even within CDC. But the White House took over the messaging, and it's very hard. We could talk about history a little bit, but when the president jumps in, it's really hard for people who work in the administration to say something different or do something different. At that moment, the president's saying, oh yeah, we're not going to have that many more cases. The cases are dwindling. We don't think this is a big problem. It'll be gone. Poof, whatever he said. Now imagine you work for the president. You're at the Food and Drug Administration, and you realize that we don't have a good testing infrastructure. We don't have companies to make tests. And, you have the opportunity to push a button on your desk and send out a message to, the key testing companies and say, we're going to need 1 million tests a day within a month. Can you do like a Manhattan Project kind of scale up to do that? So, on your TVs, the president's saying, we're not going to have any more cases. There's no need for anybody to worry. And then you're about to send out something that is definitely going into the newspaper, that the FDA is, starting this massive process to immediately scale up all this testing for 1 million cases a day, which is probably, or 1 million tests a day, which was probably would have been a good idea to do. But it's impossible to contemplate people going that much against what the president is saying. Yeah. So I think it had it is similar to the guy who said, I think the first case of anthrax is from a spelunker. And I could give you so many different examples in history when crises start, people downplay them, and it happened in China. They didn't take what was going on in Wuhan particularly seriously for the first bunch of times. It's a very common response to crisis. Unfortunately, I think the president exemplified that. And then Dr. Fauci, I think, was basically trying to tell people that, this was being worked on. But if you listen to him very carefully, he was saying, we're not asking you to change what you're doing today, but we are watching this very closely, and that may change tomorrow. Yeah. And unfortunately, I think given the president's messaging, it kind of blurred together for people. But the idea that there was no reason to worry, I don't really think that was to be a fair reading of what Dr. Fauci was saying at the time.
Yeah. I imagine it's very tough to have any sort of opinion that goes against the president when you're in the White House staff or you're in an agency that's directly tied to the White House, because if the president is mouthing off on something and you have a different position, you see it all the time in political media. People will say, well, this is the official position of the White House now because the president said this, and to say something that directly contradicts that might lose your job, or at the very least, make you an outcast. So you kind of have to decide in the moment, is this really worth going against the top who's already made a decision on this?
And it's very hard. And some people tried and got slapped down, for doing it. That set the nation's response back at the beginning. And it did so in a couple ways, not just because they let some opportunities to buy masks pass, which seems kind of like malpractice in retrospect, like they should have been buying the masks, Yeah. But it also undermined trust. The beginning of a crisis is so important. I mean, there are a lot of examples in history, and either you feel like they know what they're doing or they don't know what they're doing. And I think that the slow buildup to this over January and February and all the reassurance, undermined people's confidence that they knew what they were doing. And I think that then had all kinds of ripple effects going forward.
Yeah. Let me just say, I have no idea, and probably never will have any idea of what it's like to be the mouthpiece for an organization that is affecting the health of millions of people. When you spread information, people will take action on that. And Fauci was in that position, so I have no idea what it's like to be him and all of the different things that are going through his head. I can speak to, though, the reaction of people that I spoke to and kind of how I took things, and just having a feel for the general public at the time, looking at things on the right and the left. And one of the things that people always go back to is when Fauci said that we didn't need to wear masks. And I'm just paraphrasing. I don't have the direct quote, but he sent the message that masks were not necessary, and then later went on about a month later and said that he was saying that to procure masks or to keep the inventory high for frontline workers and people in the healthcare industry. And so for the most part, I don't think people, if you tell people straight up, don't use masks, we need them. We need to stockpile them for frontline workers, for the people that are going to be getting the highest doses of the virus, because early on, it seemed like people who were getting not just exposure to the virus, but the largest exposure in terms of the amount of the virus they were coming in contact with, that was making their reactions worse. If he had come out and said, we need to save masks for these people, please don't buy masks, instead of we don't need masks, I think that would have went a long way to build more trust, I should say, with the messaging that Fauci was having with the general public and even people that disagreed with him from the start. Maybe.
I mean, I guess I would say I remember a lot of that messaging at the time. I mean, I remember people saying, because obviously if we're with a sick person, everybody wanted a mask, you know? And so at the time, there were questions about how infectious people were if they weren't sick. And there was still the idea that coronaviruses would be transmitted through touching things. And so there was a concern that, you know, you could actually wind up giving yourself, you know, COVID if you wore a mask. And, you know, if you were just touching things, you were constantly adjusting your face, you know, and pinching your nose thing or whatever. And
wiping down Whole Foods.
Yeah, eventually that got us to wiping down Whole Foods, and
which lasted for about, you know, a week and a half. And then people were just kind of dabbing their groceries and we're like, we don't really need this.
Yeah, well, there's some people out there that are probably still doing it somewhere, but yeah. I think, you know, it was not totally known. Now, having said that, I think that people were going back, like, it is definitely the case that our understanding of this virus changed. And you can start by saying, well, we know that this is really important for people who are really sick. We don't know for people who aren't sick whether they should be wearing masks. And right now we need masks for the healthcare system, and then change, you know, and say, actually, it turns out that it looks pretty helpful for people who aren't in the... But as you know, there are people out there who are kind of mask truthers, don't believe masks have any value, you know, even today. So I do think that, I'm sure that if you could go back, people would communicate a little bit differently. I think if you really read what people were saying, it wasn't so bad what they were saying. I think partly we're viewing this through the prism of the polarization that we have, and kind of that kind of gotcha. And it's very, very hard to say, look, you said this once, and then you said this other thing once, and they're inconsistent, and you flip-flopped, and now we don't trust you anymore. And, you know, it's just really hard when there's that level of vitriol to be able to do public health, because things are going to change, and you're not going to stick every landing in an interview. Yeah. It's very hard. And so if people have a little bit of patience for you and trust in you, you can modify your messages and say, okay, hold on, I want to be really clear what I'm saying. But if people don't trust you and they're attacking you, it's just very hard. That's what I mean when I say I think it's very hard to do public health in that setting. And that's something that's hurt us for the pandemic.
Yeah. And I've changed my opinion so many times as a podcaster. I can't imagine the amount of pressure for someone like Fauci to, you know, whether you like the guy or not, he became a pop cultural icon. He transcended the healthcare public policy space. And like rappers were using Fauci's name in songs, and every decision that he made, every comment that he made, every quote that he made was being polarized in some way. And that's why I wanted to be careful with the way that I brought it up, because I wanted it to come across as try to help me understand maybe what he was thinking at the time as someone in public policy, not necessarily, like screw Fauci like this. Like, again, I have no idea what it's like to be him.
I think you have to look at everything he was saying, and I don't think he really was that far off, but he had to modify his message as the science changed. And I think what you're getting is you kind of looking back, it's through the filter of this incredibly polarized approach that people have taken to the pandemic and kind of a little bit of gotcha. And it's just hard. I mean, it's very hard for anything to survive that kind of scrutiny.
When you're developing any sort of public health strategy, whether it's for COVID or something unrelated to the pandemic, how much does quelling public panic come into play? Like when you're trying to share information that people will hear and millions of people will hear, and that will cause them to take action, where is quelling panic on the ladder of we need to hit this, like share the facts and share the actionable things? We have to phrase it this way so people don't freak out. Like, how does that come into play with healthcare strategy?
Well, there's sort of a Bible of CDC crisis communications that has the first three ideas: be first, be right, be credible. And, be first because you want people to turn to you. Be right, and in part, be right means don't overly reassure. Like, you get up and you go, don't worry, everybody, no reason to panic. It was just spelunking. Doesn't really work. You're not right, and it hurts. And also under be right is the concept of really explaining what you don't know, and that what you say, what is based on the current knowledge, and it might change. But number three is probably the most important, being credible. And so it's just really important for people to believe you. Now, that doesn't mean you have to be saying that the sky is falling at every minute, and one of the other key things is to give people specifics about what they can do so that they have some measure of control. The problem is when things are really not known, it's really hard, if you're going to be right and you're going to be credible, to also be reassuring. Like, you can't do all three things. We have a new virus. It appears to be lethal to some people. And so you can be honest and say, this, based on what we know about coronaviruses, we should be washing our hands a lot and, et cetera, et cetera. But if somebody else honestly says, like, do you think that this could kill 1 million people? Let's say somebody had said that right at the beginning, is this going to kill 1 million Americans? You really can't just flat out say, no. You don't know. So you have to say, you don't want to say like could, might, just might, I mean, that's not that helpful either. But I think you have to say, like, we're going to have to take this one step at a time. And we're going to have to deal with the information that we know and the information we don't know. We're going to have to narrow down the information we don't know. But fortunately, we have a lot of tools to take this on. We're going to be developing vaccines. We're going to have medicines. A line that I used an awful lot was, this seems overwhelming, the uncertainty at the moment. But one thing I can promise is there will be less uncertainty soon. Like, we are going to get answers to some of these questions. We are not.
That's a good line. That's like a Winston Churchill line.
Yeah,
good stuff.
I wouldn't go that far, but we're not going to be stuck in this moment forever. We will learn more. I just don't know what that is. But we just have to hang in there together. And that's just it's a difficult message, and it only works if you're credible. If people don't believe you, they think that you're withholding information from them, then saying something like that doesn't inspire confidence. It makes people incredibly anxious. So in that way, kind of the polarization and the politics of it made it just so much harder to be able to do the very difficult communication that was required. This was going to be a brutally difficult communications, challenge no matter what. But you throw on top the divisiveness, and it's basically impossible.
Yeah, that's one of the problems with the hard take culture that we're living in, where everyone has to take a hard line on every issue, is that sharing information and then saying, I don't know yet, doesn't really get you clicks. It gets you much more clicks to avoid nuance. Generally, I mean, there are some great videos and podcasts that I listen to that are incredibly nuanced and there's no answer at the end. It's just like, this is what we know right now, which were the majority of the podcasts that I listened to at the beginning of COVID. But it's not like a thumbnail-y YouTube thing to say, we don't know. Like, this is what we have right now. It can't give you an answer. But that also maintains your credibility when you say, I don't know, because you truly don't know. People will look back and say, okay, this person shared all the information they had. They didn't lie to me. And now I can trust them because when they didn't know, they were honest about it.
You could have come to my class. That would be an A+ explanation of the public health challenge of credibility in a crisis. But the challenge we had now is while the person is credibly saying, I don't know, there are people in the wings going, you're lying. You're not telling everything you know, and it's just really hard to maintain that credibility when you have that kind of side pressure. And that I think really has hurt. That's sort of the operational aspect of the breakdown of trust and how that plays out is that people in the end don't really know what to do. And even when you finally figure it out and you go, okay, we've got a vaccine that really works, go out and get vaccinated. Now people, are nervous and don't believe you, and it's just much harder.
You have an incredibly difficult job as someone who's developing public strategy because you have to balance the preserving the lives of vulnerable people and also preserving the freedoms of the general public. Can you talk a little bit about that struggle with developing strategy and communicating strategy as a public official when you have people on both sides that are yelling and screaming about protect me, protect me, protect me. Everyone wants to be protected, but ultimately certain regulations will protect more people than others. And that also varies throughout the country and throughout the world. Can you talk a little bit about the difficulty of creating policy with that struggle?
Well, I think one thing that we see in public health in general, and certainly in the pandemic, is that diseases don't strike everybody equally, and in particular, groups that have been cut out of economic opportunities or face racial discrimination or experience extra environmental threats in their community, for them, when it rains, it pours. Everyone gets wet, but they get soaked. And it was very predictable. I remember at the beginning of the pandemic when some of those initial cases were like in people who went on cruises, It seemed like this was going to be a disease of cruise passengers. One of our early podcast guests was George's Benjamin, who's an amazing public health physician, runs the American Public Health Association. And right off, he said, this is not going to stay with cruise passengers. This is going to affect communities of color, low-income communities across the country. And, are we going to be able to help them? Are we going to be able to make sure that they get access to treatments and testing and other things that are essential? And almost at every turn, we have seen how hard that is and for our system to deliver. The testing was not equal. The treatment was not equal. The vaccination program started slower. I mean, at every single dimension. And so for government, it's really important to be thinking about those very common, unfortunately, challenges in equity and fairness, and really go the extra mile to make sure that there are programs to reach people. In Baltimore, the health commissioner did a really good job, I think. She worked with Johns Hopkins, University of Maryland, some of the leading insurers. They immediately set up a call center to help people who didn't have access to doctors get testing. And they took over a hotel to help people who didn't have housing, stay safe from other people. And they hired, I think, 300 people from Baltimore City to be community health workers to help with contact tracing and eventually with vaccine confidence and other things. people to help their own neighbors to get the services that they need. So, in public health, you have to be thinking about that all the time. And every single part of the response, you have to be thinking, well, who's not going to get a fair shake, and how are we going to go out of our way to make sure that they, we try to blunt that as much as possible. Now, that's one level of public health. Then you have this additional level that I think you may be referring to where, now that there are vaccines, it's created much more of a sense that for some people that they can go about living their lives the way they used to without any problem if you just, not worry about other people. And so there's a little bit of a question about, well, what's the right line to draw to have different kinds of public health policies that reduce overall suffering, even if they impose on people who can be pretty sure that they're going to be fine if they're vaccinated, particularly if they're vaccinated and boosted. And so you have those debates happening now. Like, and oftentimes it's framed as a dichotomy between going back to 2019 in our rules and just telling people, well, if you have a problem with it, wear a mask. And on the other hand, going back to like spring 2020 and shutting everything, not maybe shutting everything down, but having a lot of precautions on everybody very, intensely. And, my view is that these are definite pressures within public health, and it is the job of public health to balance them, to find a way through to a new normal. Some people like to use that phrase. I think that works a little bit. That we should have, I think people should be carrying masks around. And if you're too close to other people in places where there's a relatively reasonable amount of transmission, to pull out the mask and put it on your face. It's not that big a deal to do, and you're able to protect other people and protect yourself. And so, what that right balance to draw is hard, and it's not necessarily a strict science. I think you have to think about, again, community cohesion and what people are willing to do. But I think it's the job of public health to squarely face that and to bring people together to talk about those hard trade-offs. So anyway, I do think that, so there are these two dimensions of this issue that we've been talking about. Like, there's no question public health has to go out of the way to help people who are at very high risk for not getting treated fairly. And then as you get further into the pandemic, the question has come up whether or not, rules should be made for everyone that disadvantage potentially a smaller group.
Yeah, I was thinking about this a lot, this dynamic, the dichotomy of I myself am not at high risk. I was 27 when the pandemic started. I don't have any sort of risk factors that would give me a higher risk for succumbing to COVID or going into the hospital. So after a few months of the shutdown, I was like, come on already, when am I going to be able to go out for drinks with my friends again? When can I stop showing my COVID vaccination or test to go travel? And then there was also a voice in the back of my head where I was like, if I don't want to build up bad pandemic karma, where if there's a pandemic and I'm 75 years old, at risk, have some other health conditions, and there's another pandemic, and like some 27-year-old kills me, I'd be like, fuck, like that kid, it's like I was trying to think about both sides of it and trying to be empathetic to that situation, because I was forced to think about that with my parents and some other people in my family who are younger in their 40s and 50s, but have conditions that put them at high risk. And so when I started seeing my family again, I was thinking about that other side of it of, okay, even if, it's very tough. It's tough to have a mandate or a group of mandates that's going to satisfy both sides. And I think we were seeing a lot of frustration on both ends of the spectrum.
You have to, and I think the solution, to the extent that there's a solution, is you have to really point your finger at those kinds of tensions and try to find ways to ease them. So, This is just a couple dimensions of that. Closing bars was the right thing to do at different times. Bars are just like hothouses for COVID. People are yelling without a mask as they're drinking. I mean, it's just, you couldn't, in an indoor location, it's just like the worst place to do it.
People yell sober outside, so you give them some drinks and just goes to a whole nother level.
Exactly. And so the idea that you would close bars in a pandemic is not crazy. It's just not. Now you do that, you don't want people who work in bars not to be able to feed their families. And you see people like, please help us. And so having a program to specifically compensate people who were losing their jobs or at risk for losing their jobs or not able to work because of actual pandemic restrictions, I think could have been something that would have been helpful. And of course, rules like, well, we will allow people to have outdoors at the park drinks. Typically we don't let people do that, but we realize that people who are 27, they need to socialize. It's important for their mental health and their development. And, we're going to organize some different kinds of events, or we'll create different kinds of spaces and businesses. And typically you can't do open containers in the park, but we're going to change that. Like, you name what the issue is and you try to do your best, consistent with what you need to do. You recognize the harms to other people. You don't just say like, hey, we're just doing this to save lives, tough luck, everybody else. Of course, another example of this very important tension is with schools. And young, as hard as it is for a 27-year-old, and it is hard for a 27-year-old. I mean, young people and young adults suffered a lot, loneliness, mental health challenges, incredibly during the pandemic. School kids were in many places really, really hit hard. The importance of peers and engagement with friends at ages 5, 6, 7, 8, 9, it can't be overstated. I mean, I'm a pediatrician. I was very, very worried about, what was going to happen. And again, some people might have just said, well, like, we're going to close the schools, period. That's it. It became pretty clear that there was going to be a big issue in the fall of 2020, for what to do. And, my view was that it's really important to point out that we have this tension and to do everything possible to find a path through it, and I thought it was one of our biggest failures in 2020, the failure to give a lot of money and support to schools to help them navigate this. Private schools in many places were able to do it. They spent a lot of extra money. They hired more staff. They got more space. They spaced kids out. They gave them masks. And lo and behold, they're back in school and pretty well. But a lot of public schools didn't have the extra resources. And people were just pointing fingers or politicizing it instead of saying like, okay, we're going to open them, but here's the path. And by the way, really vulnerable teachers, shouldn't have to go in. Come up with another approach, hire other people, do something that's unusual, And I think that like that kind of, it was hard at the intersection of public health and the economy in the case of bars, or education in the case of schools, to try to find a path through that kind of gave in a little each direction. And I think in the future we have to have better mechanisms to do that.
Yeah, that's where I had to check my emotional response a little bit at the beginning of the pandemic, because I was fortunate enough to have a job where I can work remotely. I come from a very privileged background, and if I needed to, I could always move back in with my parents, who were less than an hour away. And so when everything shut down, I was like, come on, like, you're telling me I'm going to have to make whiskey sours at home now? Mm-hmm. And people all around me are losing their jobs. They all of a sudden have nowhere to work, and their kids are also at home. And even if you are working remotely, you're now taking care of 3 kids who aren't in school. So there are a lot of different factors that go into these mandates. And I have empathy for the people that were at the much tougher spectrum of the survival, and also the people that are making those mandates. It becomes very difficult, I'm sure, to keep people sane and keep the public response manageable.
Well, I think the stress of all this has had all kinds of consequences. As you know,
Yeah.
homicides are up, overdoses are up. It's just been a brutal year. And I think that the stress that people feel is it's going to take a while for it to kind of work out of our collective system.
Yeah. Yeah. I wanted to ask you about the two different survival lines, the two, I guess survival line, you could put it that way. So you have one side of the spectrum where people are succumbing to the actual virus of COVID. And then the other side you alluded to where people are starving or they're victims of crime or they're committing suicide. When you are creating public health strategy, public policy, is there any straightforward calculation to give you an idea of, okay, this mandate is going to protect 10 million people from COVID, but we'll lose 12 million people from crime, suicide, starvation, other social factors? Is there any sort of straightforward?
Yeah, so there are different schools of thought on how to address that.
Yeah.
Because obviously, like you point out, you have to look at both things. You have to look at the benefits and risks of anything that you're doing. You can't just look at one thing, meaning society can't look at one thing. Now, there are some people who think the public health official's job is just to worry about COVID. It's someone else's job to worry about the other things. And then there should be a decision maker who's not the public health official or the other person who's going to balance it out somehow. So that's one line of thinking. There's another line of thinking that we really need to invest in, an army of economists who are going to create models who are going to help us. You plug everything in and you go like, well, this is the number of COVID cases you'll prevent, and this is the number of suicides in the other direction, and then we're going to weight this in a certain way, and in the end, the model gives you the answer on what to do. I think the problem with the first approach is that it's very hard for people who don't, I think it's, while in theory, you have the public health official talking about COVID and someone else talking about the other thing, really it's the intersection between the two that's the most important. And the question is, can you mitigate some of the downside impacts? Like, what are the trade-offs in between the two? You can't really get to that if everybody is totally in their lane alone.
Yeah.
So
it's I was just going to say, it seems very counterintuitive to have people siloed within public health of one's going to be disease, one's going to be social. It seems like it would be to both sides' benefit to have some interaction so you can understand that COVID doesn't happen in a vacuum, that when this mandate happens, this also happens to people.
Right. And can you do the mandate a little differently? Can you do the mandate a little differently that'll make it a little better on the other side? And I think it's better for someone to be thinking about both of those things, like everyone to be thinking about both of them and to work together for a solution. The army of the economists approach, I think, is just really hard because you could have 50 different models. So which one do you believe? And it's not so easy for people to throw together models, and you have to make decisions today. So it's just a little bit of an ideal that is hard to reach. Even now, we don't have a lot of data that could go into a model that would actually be very informative on some of these decisions. So you're trying to make decisions under conditions of uncertainty, not knowing everything that you have. So you have to be honest about that. I think that you, as a public health official, you have to recognize the kids not going to school is a public health problem. The young adults being depressed is a public health problem. The people being out of work and not being able to feed their families is a public health problem. And so, you have to be able to work your way through and talk about it and help elected officials, the ultimate decision makers, see both sides and see what as best as you can what those trade-offs are, and try to find a path between it. It's messy. This gets back to your very important point, which I might take in some of the ways I think about this on hard takes. I haven't thought about it that way. It's a variant of your hard take theory here, which is that it's a lot easier to be like, no public health measures, keep the bars and restaurants open. That's my hard take. Or we can't let people die. We're going to close the bars and restaurants. That's my hard take. As opposed to, in a way, those are easy takes, right? I mean, you can just argue one side of the coin. But to see both of them and say, here's what we're going to do, especially for restaurants and bars, because we need to keep them closed for as little period of time as possible. We're trying to help both keep people from spreading COVID at this moment, just months away from when we're going to get vaccines. But at the same time, we don't want people to be, specifically, it's just a much longer take. There's no, it's not a hard take. You come across like you haven't taken a position, but really you're trying to find a place in the middle. That's what really good public health does. But it's been very difficult to do.
Yeah. And it's a very deep problem because the algorithm of social media, YouTube, Instagram, Twitter, rewards hard takes. And for example, when I log on to the YouTube channel, I can see how many people are watching the clips, which you can see as the public facing consumer. But then on the other end, I see what percentage of the video is viewed, what time code people are dropping off compared to which videos. And so you want to have a take that is keeping people engaged, whether they're love watching or they're hate watching. So if you're talking about the vaccine, and you start off and you're saying, we don't really know this, we don't really know that. A lot of people will just click and be like, bored, next video. And then someone else will be like, the vaccine's gonna kill you. And like, you're like, oh my God, I have to. And then maybe at the end of the video, they'll just be like, by the way, sorry for the clickbait. I was just trying to get you to watch. And I'm a huge fan of a lot of podcasts that live on hard takes. One of my favorite podcasts is Flagrant 2 by Andrew Schultz and Akash Singh, both stand-up comedians in New York. And they have much more of a pop culture podcast where they're reacting to things in sports, music, some politics things, but like really staying in that creative space. And they're just like hardline having hard takes, but it's all funny. It's all funny. Like there's this understanding that we're saying this because it's outrageous, and whether you agree with it or not, like we're trying to make you laugh. And then some people will take that approach, but talk about very serious topics, and it's not clear that it's a joke. It's not clear that they're saying something to be provocative, and that message gets blurred.
But even you can take a step back from that even and just say, even if people aren't saying it to be provocative, just the people who really want to just talk about one side of the issue are more likely to be, heard in a way than people who are talking about shades of gray in any particular issue. And maybe for this reason, we're not going to have too many people listening to this podcast, for which I apologize to you in advance.
No, I mean, I was just going to say, I've been lucky that people seem to, at the beginning, it was very hard to have a podcast that was covering a bunch of different topics and people from a bunch of different backgrounds. Like I started out with music artists, and then I started interviewing writers, scientists, athletes, and it was hard for people to lock into. At the beginning, I was getting huge spikes in episodes, and then people would not listen to the episode after that on something completely different. But over time, if you do a decent job at hosting a podcast, if you build a reputation, hopefully I'm building trust and reputation with my audience, people are willing to just listen to your podcast because they enjoy their podcast. So I suspect that the numbers will continue to reflect that the interest is remaining high as long as I do a good job. So hopefully I'm doing a good job.
Well, that's good to hear. I mean, I think for our podcast, we opted against having like really extreme voices that we didn't think were all that credible, and we've gone with much more nuanced discussions, and, we found our audience. I mean, there are a lot of people who are interested in that. But I think we probably gave up the, 100,000 download episode by not being more provocative. I think as a school of public health, we wanted to try to find a path that is representative of the difficulty in thinking about some of these issues.
I think there is a middle ground, though. I think you can talk about things that might be seemingly I don't want to say boring, but seemingly a less engaging topic, but then add a twist to it to promote the episode. There are a lot of podcasters where I will listen to an episode on something, like the microwave industry or something. Give an example, like just something just completely dry
Right.
on the surface, but they made some interesting reel about it that I saw on Instagram or YouTube, and it kind of drew me in to their podcast. So I think there is a middle ground of recording podcasts the way you want to record them, and then being creative with the promotion and how you draw people in. And a lot of times, I do this myself. I'm like, oh, like this made me laugh. I have to check out the podcast now. And it's not as high energy as the reel, which no podcast is, but it draws you in to listen to the conversation, and maybe you stay a listener of that podcast, or maybe you listen to one episode, you're like, oh, it's not for me.
Well, fair enough. Well, I'll give you one something that I have a harder take on then.
Oh yeah,
to help with that. So
let's do it.
I personally feel that the Food and Drug Administration in particular needs to be much more transparent about what it's doing to work on particularly children's vaccines. I don't like the fact that we learn about what happens about vaccines from the companies primarily. And it's sort of like unnamed sources in the newspaper or company CEOs. They're great people at the Food and Drug Administration who understand trials of vaccines for kids and all the challenges that they're having incredibly well. They work for the American people. I think FDA has some outdated policies that keep them from really explaining what they know. And it's been immensely frustrating to parents of young children, who have just had such a hard time, like you said, during the pandemic. They deserve the best information about what's happening about those vaccines from people whose job it is to really protect the public interest. I think those people are doing a good job, but I think they need to be allowed to speak more and to share more information so that parents really understand what's happening.
So it's that great hard take, by the way. So it's the, so you're natural at this. So you're saying that the FDA, the way they're communicating about children's vaccines is shady in some way, or they're not giving
shady,
people...
It's quiet. It's very quiet. Okay. And it's traditional. So the way FDA traditionally regulates is they say like, okay, we've got all the expertise. You come in with your application and we'll tell you whether it's good or not, and at the end of the process, we'll explain our decision. And, that generally works most of the time. But we have a pandemic with intense interest in what's going on. And, typically during a regular process, the company might be the one communicating with its investors. Here's what's happening with our drug on hypertension, et cetera, et cetera. FDA just weighs in at the end of the day. But now there's so much interest along the way, and there's so much misinformation that FDA should be doing things differently. FDA should be out in front, explaining the status, not letting all the information just come from companies, some of which turns out to be wrong. I think it's not a question whether the FDA is doing a good job in thinking about the regulation. It's about how people understand what's happening. And I think parents deserve to understand more. And so I think it's not for any, nefarious reason, but really because the traditional approach that the FDA has taken just doesn't work in this moment, in this environment that we're in with so much misinformation. I think it's really time for FDA to become a lot more transparent. And the most obvious example of that is around pediatric vaccines.
So they're kind of just red stamping the vaccine at the end, saying, this is good or this is bad, and they're not really being transparent about the whole decision-making process. Like, what is the problem with the vaccine, or what's the research showing?
Yeah, or why is it taking so long? I mean, we've heard, well, it was the studies were supposed to be done at a certain time, and now maybe something's happened so that the initial results weren't as good as expected, so now it's going to take more time. But not that much of that information has come from the people who really are in the best position to talk about it. And I think this really matters, and people should really hear from them along the way, and not have to rely on the companies. And I don't want to besmirch the companies. I just think that for people's confidence, they should hear from the people whose job it is to represent and work on behalf of the American people.
Yeah, I'm glad this came up because I wasn't sure if this was gonna, there's gonna be a transition into this or a segue, but I was reading a Wall Street Journal article on the anything but Sharfstein memo. Excuse me, because I was going through just your basic Wikipedia bio, and then it said something about the ABS memo, and I was like, all right, I have to check out this article. So I bought the $4 subscription to Wall Street Journal just so I could read this article, and maybe I'll keep the subscription because there were some good stories on there. But it was to summarize the article. You were once being considered for chief of the FDA in 2008, and an anything but Sharfstein, quote, ABS anything but Sharfstein memo was passed around by drug companies and special interest groups, and you were mentioned in the Wall Street Journal article as an outspoken critic of the FDA, and other drug companies at the time. So I wanted to ask you, what was the whole memo thing about? What went down back in 2008?
I don't know exactly because nobody ever sent me a copy of that particular memo, if it existed. At the time, I was the health commissioner for the city of Baltimore. And one of the things that I was best known for was a project raising concerns about over-the-counter cough and cold medicines for young children, which had killed inadvertently. Parents and grandparents were giving doses of the medicine and children were dying. We had 4 deaths in Baltimore City.
Jeez.
And where I was the health commissioner. And in fact, there were papers written about a lot of kids, maybe not a huge number of kids, but in the hundreds of kids who were severely injured or dying. And there was just not data showing that these drugs worked. So you had a situation where there's really no evidence of effectiveness and clear evidence of harm. Why did it make sense to sell these products? And so, I said that, and we petitioned the Food and Drug Administration, a group of pediatricians, myself included. The FDA actually largely agreed with us, and the products came off the market for kids under 4. And so you can't get these products for kids under 4 in the United States anymore. And I was largely responsible for that effort to call attention to that particular problem. So on the one hand, I had a reputation for raising concerns about the pharmaceutical industry, and in particular in that case. On the other hand, at the time, very same time I was doing that, I was actually defending the flu vaccine against some critics who said it was dangerous. And in that case, I said there's a lot of evidence that the flu vaccine prevents hospitalization and even death, and it would be a disaster to take the flu vaccine off the market. I was testifying in the Maryland legislature. And I also was leading efforts to increase the use of a medication to treat heroin addiction in Baltimore City, which was a major campaign that led to an enormous expansion in access to treatment and contributed to a 2/3 reduction in heroin overdose deaths in Baltimore City. So on the one hand, when I felt that medications were harmful, I was quite outspoken about taking them off the market. On the other hand, where I felt that the balance of benefits was enormously in favor of using medicines, I was actually out there as a big booster of them. So I never felt that my overall record was worthy of an anybody but Sharfstein memo from the drug companies. That was never my perception. And so I don't know whether that actually happened. In the end, I wound up as the acting commissioner and the principal deputy commissioner of the Food and Drug Administration. I worked there for 2 years. So it didn't really keep me from going to the Food and Drug Administration. And when I was there, I had a good relationship, generally speaking, business relationship with the pharmaceutical industry. I met with them. We, had different, conversations on different topics. I have not worked for the pharmaceutical industry. I just have felt like, having been at FDA, it's just as well that I don't. But maybe I'll change my mind about it some point in the future. But I think I've generally been independent, and I kind of try to call them like I see them. There are times now when I'm a huge advocate of using medications to achieve a public health benefit, and at times, I've had drug companies call me and offer me grants to help because they're so excited that I'm supporting the use of their medicine. And at other times I've said, I have concerns about this for this reason. And I like just being able to make those judgments based on the facts at hand.
Yeah, I believe the word independent was in the title of the article. It was either way, the overall vibe that I got from the article was that the FDA was looking for someone that wasn't as independent as yourself, to put it charitably.
Well, I think that the medical products industry is very important in this country, and they create great products in many cases. If you look at COVID vaccines, those vaccines have probably saved my life during the pandemic, and the lives certainly of my parents and others. That I love. So, it's really important. And I also think that regulation and independent regulation is really important for the success of the industry. And in fact, I think history bears that out. As FDA got stronger, the industry got richer, got more successful. The 1962 law that requires clinical studies, added a whole burden for drug companies to prove that their medications worked. But then once they did that, their medications worked. And suddenly people are spending a lot of money for them because they actually work. And how do we know that a medication works? It's because the FDA says it works. They're great people at the FDA. It's an agency that does an independent analysis of the data. And so companies actually can do quite well if there's a credible regulator. But if the regulator is too cozy with the industry and it undermines the credibility, and they make mistakes and it harms people, I don't think that's in the best interest of industry or the public. And so, that's always been my view. And it doesn't mean that there aren't compromises to be made sometimes, but it does mean that independence is a very important quality in a regulator.
I do have a ton of questions on the opioid crisis because I know you and your wife wrote a book on the opioid epidemic, but perhaps we can record a part 2 another time because there's so much stuff to get into. But I do have one last question on that's FDA related. So I understand that you were instrumental in taking Four Loko off the market. To the disgruntlement of college students across the planet back in the 2010s. I think it was like 2008, 2010, somewhere around that area. And Four Loko, for people that don't know, it has an enormous amount of caffeine and an enormous amount of alcohol, all packed in one can. So you have
Don't forget the sugar.
The sugar too. Yeah, you have this energetic blackout effect where you're just drinking more and more. You don't feel tired and you just keep going, and then you don't remember anything and you wake up the next morning, which I've done a few times back in the day. I wanted to ask you more of a philosophical question. Four Loko is something that can seem great in the short term. It's giving you that boost, and then long term, if you keep drinking it, you feel more and more like a degenerate as your body and mind wear away into the night. Is there any sort of habit? Is there a habit or something that you thought was good for you in the short term, but you ultimately stopped doing in the long term because it was detrimental or dangerous to your health in some way? So in essence, like something that you took off the market in your own life.
Wow, I didn't see that twist in your question coming. I thought we were going to talk about Four Loko. I would say that it sounds like we had different perspectives at the time on Four Loko, not meaning disagreements, but at least we were seeing the issue from different vantage points.
Yeah. We'll do a part 3 just on Four Loko, like 3 hours just on Four Loko.
Yeah, it's anytime Four Loko comes up, I definitely get some mean tweets directed at me. But, this was seriously a product that was causing an enormous amount of harm. And the question for FDA was whether it's safe to add that much caffeine to alcohol. And the condition that people were talking about, and we had a lot of experts, emergency doctors seeing problems, was characterized as wide awake drunk, that people were drunk but not perceiving how drunk they were, and that led them to drink more, get behind the wheel, assault other people. And fundamentally, there's a law that says you can't add caffeine to stuff unless you can show that it's safe. And the manufacturers couldn't do that. And so that was what's really behind that.
Yeah, I had the college student POV, and you had the medical professional POV.
Right, exactly. In my own life, it kind of goes from things to things. I guess I don't know if this fits. Sometimes I will watch a kind of TV show that's a little bit dystopian. It sort of like helps me kind of take my mind off all the troubles of the world to watch some world where it's pretty dystopian. But then over time, by the time I'm into the second or third season, it starts to feel depressing to me. I can only watch so many dystopian TV episodes without, it's starting to wear on me. So then I drop it. So I don't know if that's really what you were looking for, but that's what came right to mind. Sometimes
that fits well.
Yeah, I think for all of us, we get to make decisions for ourselves about what we like to do, what we don't like to do. And there are some things that are a little better in the short term than over time, again and again and again. And, as you get older, you kind of settle into things that really you like to do. And so, I don't know, it kind of depends, but there are some things. Sometimes I go through similarly certain genres of books. I read a lot, and then I feel like I've read too many, and then I take a break. But and I switch to something a little bit lighter. But in the end, I think that we would. It's moderation, which is a generally good public health principle for a lot of things, but it's also having, grace for other people. I think during the pandemic, that's been a very important lesson. Everywhere that I look, there are people who are stressed, and I've really done my best, even though in the moment it may feel good to express frustration at somebody. It could be the person in front of you in an airplane line, whatever it is, in the supermarket, in the workplace, in your home. There are people out there, it feels good to really give them a piece of your mind. But I don't think that's the 2022 thing to do. I think it's just good to give people a little bit of room. Everybody's coping with the trauma of the pandemic in a different way. And you have to, do your best to keep yourself afloat without trying to presume too much about other people. And that's hard. It's hard with the politics of the pandemic. It's hard with everything. But I think it is probably what we're going to need to do to come out of this really difficult situation.
Yeah, going back to the dystopian TV shows, what's that quote by Nietzsche about the abyss? It's like, if you stare too deep into the abyss, you become the abyss, or something like that, or it stares right back at you. So I've definitely felt that with TV shows like Black Mirror, where you watch 5 Black Mirror episodes in a weekend, and you start to think that people are bugging your apartment and the whole world's against you, and you're like, I need to watch something. I need to watch some New Girl or something like that. I need to take a break because this is transforming my mind. And that also goes back to the beginning, to bring things full circle to the social media. When you get trapped in the abyss of a certain silo, and all you're consuming is just one portion of the conversation and one slice of all the information out there, you start to crave it more and more and more, and you don't realize that you're kind of getting sucked into this abyss. And once you're in, the further you get in, the harder it is to come up for a breath and look around and get some fresh perspective.
Well, I really appreciate your having me on the podcast.
Yeah, of course. Thank you. This has been great. Before we end off, is there any website? I know you have a couple books on Amazon that you wanted to plug, and I'll link everything in the description wherever you're listening or watching this. Your podcast as well.
Sure. Well, the podcast is Public Health on Call, and it's available everywhere. You can check it out. A lot of different types of episodes we do. They're all 10 to 15 minutes, and so pretty quick. I did write the book on the public health crisis, and I wrote a book with my wife, as you said, Dr. Ingvild Olsen, called The Opioid Epidemic: What Everyone Needs to Know. But more generally, some of your listeners may be interested in public health, and this has been a moment where people pay a lot more attention to public health, and they think, like you, well, what's it like to be in that position? And how do I balance these different challenging issues? And maybe they think, I want to be an infectious disease modeler or a virologist. So the School of Public Health that I work on, the Johns Hopkins Bloomberg School of Public Health, is the largest school of public health in the world. We've got students, thousands of students studying all kinds of things, many of whom do so remotely. We have different kinds of scholarship programs you can read about. And so I'd encourage people to think about this moment where everybody's kind of reevaluating exactly where they are, where they're headed. If public health might be in your future, you should check out the publichealth.jhu.edu.
Awesome. Well, thank you, Dr. Joshua Sharfstein, for your time and for the nuance and the hard takes. Both are very much appreciated. And this has been a blast. Thanks again.